Good afternoon, everyone. It is Wednesday, July the 15th, 2020, and we're here for another webinar as part of our Mobile Health Program webinar series, Summer 2020. My name is Noelle Duckworth, and I am with the Partnership for Healthy Communities here at the University of Delaware. We are part of the Community Engagement Initiative, a broader initiative that's cross-college out of our Office of the Provost. Our director is Rita Landgraf. Our associate director is Erin Knight. I'm the coordinator for the program. We have Paulette Hussey-Caston as our administrative specialist, Christine Sawinski, who most of you know through your work at the Mobile Health Program as our mobile health coordinator. And then we work with Kate DuPont-Phillips, who directs our Healthy Communities Delaware initiative. So we're all very excited to have you here and to be part of this great webinar series. Who's joining us today? So we've had a wonderful response to this webinar. I know I want to congratulate everyone for making time for self-care and to learn about stress and mindfulness and stress recovery today. We have one person who registered that identified as both a UD student and either a faculty or staff member. So I can imagine that person could really use some good self-care. That's a lot of hats to hold to be working and or teaching and being a student yourself. So kudos to you. We have 13% of our audience is our students. So thanks for joining us during your summer. And 16% identify as UD faculty or staff. Again, glad to have you. And then a whopping 73% are our community members, residents themselves, and or organizational partners. So we're so delighted to have you here. We're so glad that we can bring you this service and excited to share our resources and information from our partners here at UD and our students and faculty who have given their time for this program. Just some technical details for those of you that might be joining us for the first time or aren't familiar with Zoom webinars. We're all getting more familiar now, I know, with remote learning and working. But the audience lines are muted and they're going to remain muted throughout the presentation as well as videos. So we won't be able to see each other or hear each other, but we can engage in a couple ways. One, if you look at the bottom of your screen, there is a Q&A. It looks like a little folder at the bottom of your screen if you hover. And that is where we'd like you to pose any questions that you have that you want the presenters to answer. We will have a question and answer session towards the end of the webinar, and we will pose those questions. So throughout the webinar, whenever you have a thought or materials being covered and you want to ask a clarifying question or dig deeper, please write it in that box and we will work to try and get your questions asked and posed. We also have a chat box where you can submit a technical question or share information or resources or just comment and say hello to others that are joining us today. If you wouldn't mind in the chat box, just take a few minutes. You can start to just share, where you're joining us from. Are you what town? If you're with an organization or a community group, if you're with a student, a program, or a department at the university, we'd love to hear where everyone's joining us today. So that's the main housekeeping. And that also we are recording this webinar. It will be made available for viewing after today's presentation. And following the webinar, when you're done, please make sure we'll be sending you a link to a brief evaluation survey. We really would love your thoughts. This is our first time doing a webinar series, and your feedback is quite important. If you've joined us already for one of the webinars in this series, we do have a few questions to ask you again about this specific webinar, but then it just shoots you right to the end and you don't have to answer all the other questions you might have answered before in general about your feedback. So please just take a few minutes to do that. We really appreciate it, and I know our presenters would like and value the feedback as well. I'm going to turn it over to Christine Sawinski, who's going to talk to us about what's in store for the rest of the summer.
Great, thanks Noelle very much for giving us that introduction. And thank you all for joining us today for our third webinar in our Summer 2020 series. I'm Christine Sawinski, the project coordinator for the Mobile Health Program, and I'm very pleased to be part of a collaboration to bring mobile health services to Delaware communities while building workforce development for University of Delaware graduate and undergraduate students. It's my great pleasure today to introduce you to Dr. Sandy Gibney. Dr. Sandy Gibney is the medical director for the Mobile Health Program. She precepts all of our students who work with the program, and she is also the emergency room physician at St. Francis Hospital. Sandy.
My name's Sandy Gibney. I'm the medical director for the St. Clair Van, and as well as the partnership for Healthy Futures between Highmark, University of Delaware, and St. Francis Healthcare, Trinity Healthcare. So wonderful to have you all here. This is one of many things to come. Just quickly, this partnership started as an opportunity to teach students how we do medicine out in the community, as well as through the hospital. I'm a graduate from University of Delaware. Both my undergraduate degree and my master's degree was at University of Delaware. And then I took advantage of the Dimer program and went to Thomas Jefferson University through that program and graduated medical school there and took on residencies both at Christiana Care in family practice and then eventually up in Philadelphia Graduate Hospital in internal medicine, emergency medicine. And so I've been practicing medicine now for 26 years. And as medicine is evolving and the opportunities are growing, we saw as a perfect option an opportunity between the Lieutenant Governor and Rita Landgraf, Kathy Met, and Christine as well, to collaborate together as a partnership to try to teach all types of students in the healthcare field how to address medicine at a different angle. And one of those is to meet people where they live, to provide community medicine. It's harder and harder for people to get into hospital systems. And certainly now with the pandemic, things have really shifted on their access as to how we're going to provide medicine. So this is a great opportunity. And actually, today is our first day back out, but we had been out for about a month, providing services to our community partners, which were many, probably about 12. And we had medical students, we had nursing students, nurse practitioner students, health science students, research students, health coach students with us, getting a fantastic hands-on experience, doing everything from learning how to land spoils and do pap smears and understand how to read EKGs and all these things that we do firsthand. So it's a grand opportunity. And the students work with me as well as the nurse practitioner, typically 5 days a week. So we encourage you to think about that opportunity. It's been a great, and we'll be back to it. We've kind of morphed to doing COVID testing right now in our community activations, but we will be back. And so that's basically in a nutshell what we do in community-based medicine in great partnership with U of D. So I'm also, Christine, I guess I'm honored with moving on to present our speakers for today. And if I can be so bold as to do that, we have two speakers today. We're honored today's topic being talking about stress, recovery, and mindfulness. And I urge you to look at some of the future topics because we're going to be going further beyond. I'm going to be presenting at one point a topic about COVID and all that it's morphed in the community as well as in the hospital. So I'm looking forward to being a presenter. But today we have some esteemed guests, Dr. Michael McKenzie. He is the Associate Professor of Health Behavioral Science and Director of the Mind Body Behavioral Lab. He is the academic director and clinical health coaching. So this gentleman has an amazing ability to help us handle stress, recovery, and mindfulness. And I know certainly that is in all of the forefronts of our minds. And followed by one of our own recent graduates in a master's program, Alyssa Salini, who's from the University of Delaware, has graduated with her master's in health promotion. She's a clinical health coach. She also is a registered yoga teacher, which we all can certainly benefit from that, and a certified health education specialist. So with that, I turn it over to them, and I encourage you all to sign back in, and I look forward to speaking with you more.
Thank you, Dr. Gibney, for that introduction. I'll turn it over to Dr. McKenzie and Alyssa.
Thanks so much, Christine, and thanks so much, Dr. Gibney, for that very thoughtful introduction. I can just give everybody a little bit of an introduction today in terms of what we'll be talking about, and then we can move right into some practice, actually. It is July of 2020. If anyone isn't stressed out yet, you can raise your hand in the chat room. We live in very interesting times. So today we'd really like to take you through a very sort of introductory intro to, the context of stress in our lives right now, what we can do to sort of aid in our recovery, as well as what's the role of mindfulness within this sort of dynamic of stress and recovery. So I'll be doing a little bit more of the chit-chatting today, and Alyssa will be leading us through some practices.
Yeah, and on that note, thank you, Mike. So we'll be starting off today actually with a little micro practice. We'll be doing quite a few different micro practices throughout our presentation. So we'll be taking this moment to arrive here. We want to click on to the next slide. This moment to arrive practice is just taking a quiet moment to arrive here before, oh, there we go. Now I'm on, got my video going. This is a little practice that you can do anywhere, particularly right now with all of us using things like Zoom and being online for all of our social obligations as well as work obligations. This is a really nice practice. So I invite you now to just do that. If you want to go ahead and softly close your eyes and maybe just inhale and roll your shoulders up, back and down, and just take a deep breath. Taking a moment to arrive here in this lecture, in this webinar. And then go ahead and softly blink open the eyes. So that little moment to arrive, you don't necessarily need to close your eyes there, but it's always nice to just take a moment to reset. So hopefully you feel a little more refreshed and alert, and we'll continue on.
Thanks so much, Alyssa. Noel, can you advance the slide? So really the way that we'll approach stress today is from a fairly holistic fashion. So, the $10 word that I'll throw around today, and I promise that's the only one, is this whole notion of psychophysiology, which is really within sort of the, research parlance, that's that whole mind-body connection, and the tension that we often feel in relation to real or perceived challenges. And I think many of us right now can think of some very real challenges that we're facing as we're trying to live our lives and do our work and take care of and protect our families during a very challenging time. These stressors can be both internal or external. This can be certainly, many of the things that are going on in our environment around us, as well as our internal responses. And those things can be happening in the present moment. Those are things that can be happening as we reflect on our histories and our past. And those are also things that can happen as we project into the future in terms of our hopes and our dreams and our worries. Fortunately, stress isn't necessarily a negative thing. So we have a couple other words here. There's distress, which we often think of in terms of negative stress, but there's also this knowledge of eustress, which is often the experience that we have in the face of overcoming or working through a challenge. So stress can both harm us, but it's also the thing that strengthens us, much like a run or a walk strengthens our cardiovascular system. We test the system a little bit, and we achieve a level of fitness from that. The same thing with our stressors in our lives. If we're able to sort of work through them, it does actually help us in terms of our overall psychophysiological fitness.
Yeah, and then on that note and continuing on, we'd invite you to share, if you want to click on to the next slide, what are some examples, or perhaps share one example of stress and one example of eustress or positive stress that's going on in your life right now. Feel free to share in the chat box. Nursing school, certainly tough. Let's check in for a couple more. So if you want to go ahead and share any stressors that you have that you're facing in the chat box, sometimes it's nice just to know, you're not the only one out there. And then feel free to share any eustress, things that are motivating you. So that could be things like school and work. So after you share, if you want to go ahead, we'll check in with another micro practice. So again, if you want to find a nice tall spine and just take a deep breath, we're going to do this head, gut, and heart check-in. So if you want to go ahead and softly close your eyes or gaze down at the floor, take a deep breath and bring awareness to your head. What thoughts are passing through your mind right now? Just acknowledge them. And just check in about how you're feeling about these thoughts that are passing through your head about this present moment. Next, shift your awareness down towards your gut. You may choose to place your hand on your abdomen or lower belly. We hold a lot of emotions in our gut. Check in and notice how you're feeling today. What emotions are you holding within the body? And see if you can move past these emotions a little bit and perhaps find any intuitions that are passing through. Intuitions are kind of our innate inclinations towards a certain, pulling us towards a certain thing or another. And then next, shift away from your gut and place your hand on your heart. Take a deep breath and tune into your heart. Within your heart, you can hold intentions. What was your intention for showing up to this mobile health practice today? Maybe bring that to mind. Does it line up with any values you have? And then after passing through the head, gut, and heart practice, go ahead and release your hand and take a deep breath. And you can move forward with those, noting the different sensations that arise through that practice. So we'll go ahead and move forward here. Feel free to share any thoughts you have on that practice in the chat box. And we'll begin to talk about stress response.
So a picture's worth a million words, or 1,000 words. And this is something that we work with a lot when we're seeing people, both in terms of some of the previous work that I did in the cancer world, and certainly some of the work that we do when we're working around stress-related issues, when we're working with clients, in a coaching setting. So the first slide at the top is this, what is often termed this normal, and I use very large quotes around the word normal, thoughts around stress response, that something happens to us, we recover from it, and then we're kind of back to whatever our baseline was until the next challenge comes up. And as we're finding with life in general, let alone life in 2020, that is not necessarily an accurate portrayal of stress for us. The reality is most of us right now, and some of you were very, very appreciative of the examples that you shared in the chat, are experiencing repeated hits right now from all sorts of directions that we're trying to cope with it, being it job loss, being it working from home, being it trying to watch out for our family. Many of us are in caregiver situations where we're looking after either small children, or perhaps we're a little a little farther along in that cycle, and we're actually caregivers for our parents. So there's a lot that can be going on right now, and this is where we really see this these repeated hits that come from all these different areas. Invariably, for many of us and for most of us, at some point the system can't keep up, and we sort of see this lack of adaptation, where our ability to really respond to any one stressor in a meaningful way starts to be impacted. The challenge that we have physiologically with this is what our body tends to do is we tend to upregulate so that we're on sort of a higher level of alert all the time while we're waiting for these things to come at us. And this is really challenging. So what we see, in those cases when we kind of go on high alert, for many people, we see things like increased worry, we see increased agitation, we can certainly see people having sleep-related issues, and we see a lot of that. It's very, very common in terms of the work that we do. And then the other end of that is if we're on alert all the time, then there are probably periods of the day where your body just says, you know what, I've had enough. And we go into these sort of extended periods of fatigue where people are sort of this tense, tired. I know I have a lot to do, but I don't feel like I can do any of it. And I can't tell you how many times sort of since March, I've had these conversations with people, and I've experienced it myself, where there's so much to do, but the body's really just saying, I don't know where to start or how to sort of make my way through this. So really, when we add these things up, we can see inadequate response over time. And that's not necessarily to everything. We might be still performing well in some areas, but other areas are starting to kind of take a hit. So this is kind of the map that we work with when we're working with clients. So if we can just move ahead, Noel. So a lot of what we can work around with people, and we're going to do a little bit of this later today after we get through some content, is how do we help people take fewer hits? Sometimes in a situation like we have right now, some of those hits are absolutely beyond our control, but how do we help people to regulate around the things that they can? As these things are coming up, how do we help people to more readily habituate around these stressors as they're coming at us? And one of the ways that we do this is we're really helping people around recovering as these hits are coming up throughout the day. If we were to, I would invite for the chat right now, and it's anonymous, and please don't feel like you have to, but if you were to rate your stress level on a 1 to 10 right now on a sort of a typical day, you could just throw a number into the chat box right now. That would be really helpful. So just typical day on a scale of 1 to 10, 1 being no stress, 10 being super stress. What's your typical level of stress? Okay, now you guys are the best. This is awesome. The numbers are flying. This is so cool. Well, this is so cool. All right, sorry. So this is great. So we have a few people that are 3s, but we're seeing like a lot of 6s and 7s and higher. So what does it feel like to walk around at a 6 or 7 all the time? And what are the things that we can help people do so that we can sort of lower that level of arousal, so we're getting people back down to walking around at a 3 or a 4. We don't want to be Pollyannish about this. We don't want people to be feeling like there's nothing's wrong in the world. Obviously, we all have our challenges, but how do we sort of develop that base level of resilience and help people bring things down over time? So this is really this notion of having this lower tonic level of arousal. Noel, can we move forward just one more? So what we want to kind of work around today is this notion of not only like the magnitude of our response to things, and sometimes, for many of us right now, we're just having to respond all the time. So that response can be pretty intense, or we're so far the other way where our system's depleted, we're not able to respond at all. The other thing we want to start to look at is what are our recovery strategies so that we can modulate some of this stress response. What we're finding now in the research is it's not only our reaction to stress that's important, but it's really helping people to recover between these stressors where we are probably making the most difference. There's a very famous book by triathlete Say Roundtree, and she says, everybody wants to write a book about fitness, but nobody wants to write a book about recovery. But recovery is kind of where a lot of our growth happens. So we'll keep things pretty recovery focused today. So really the notion that we'll play with is recovery really depends on how do we reduce these stressors and how do we take a break from stress? How do we alternate psychophysiological stressors to optimize recovery? How do we let one thing rest while another system stays active? So the example Alyssa and I were talking about the other day is the phone analogy and screen time, which for us, for many of us just living in this world, there's multiple screens. When we look at the students that we work with on campus, there's lots of screens. So how much sort of modulation in our recovery response are we getting if we wake up in the phone, look on our cell phone, make it over to the computer, get on our laptop. To take a break, we get back on our cell phone and check text messages or emails. Get home, turn on the TV, and probably check email one more time before bed. So our screen time is absolutely insane. So some of the work that we really want to do with people is around this recovery piece. So how do we sort of take these times where we're wanting a break and use those in a more functional way? How do we address our stressors in a meaningful way and then back off and not let them kind of linger? And we'll talk about what the role of mindfulness in this in just a second.
Yeah, so on that note, we're going to go into a little mindfulness 101. First, we want to ask you, we know that mindfulness is such a buzzword here. So if we want to go on to the next slide, feel free to share. Oh, maybe we went a little off here.
No, that's okay. So yeah, go straight, Alyssa, go ahead.
Yeah, well, we can go ahead and if you want to just share in the chat box, what comes to mind when you hear the word mindfulness? Being present, self-awareness, paying attention. We're getting all these good definitions here.
Wow, nice.
And focus. So I'm seeing a lot of patterns: awareness, focus, presence, being in the moment. And then with that, we'll go ahead and offer up a few other definitions of mindfulness.
Awesome, this is great. So the sort of the larger working definition that we'll work from today is really this notion of how do you pay attention, how do you become aware, how do you do this in an active way? How do you train this as a skill set? How do you do it, as many people have said, in the present moment? So really, we're really kind of honing in on a number of different things in the present moment. Well, in a minute here, we'll go through what those things might be. And then this other piece that doesn't necessarily come up as much, but is equally important, is this notion of doing things non-judgmentally. So one of the key factors in mindfulness is that things come up, we kind of separate ourselves from that, what we call sort of this discursive awareness where we're wanting to make meaning of it and focusing more on just letting things be as they are. So acceptance is a good word that we could use. So rather than sort of things happening and me feeling like I need to create a narrative around it, or that I need to work on it right away, or that this is a problem that needs to be solved, I kind of just let it sit for a minute and nudge non-judgmentally and kind of accept things as they are. And it's easier said than done. So the other thing that I think it's important for us to talk about in this area of mindfulness is that it's really part of a large number of different practices that have been developed over several millennia across many different contemplative traditions, and now much more rigorous in the area of scientific research in the last probably 60 years, and particularly in the last 20 to 30 years, where we're really seeing that mindfulness isn't necessarily this one thing. It's a number of different training regimens that all, as a sort of common denominator, have some sort of direction and regulation of attention. And the byproducts that we see across these practices is certainly this physical and mental relaxation, some sort of management or reduction of stress, more psycho-emotional stability, and then more, can you go back? There we go. And then the other piece that we see a lot of the time is enhanced concentration. So we'll sort of break these down in a second, but Alyssa's just going to lead us through another little practice here for a sec.
Yeah, so with all that in mind, having a little bit of basis of what mindfulness is, we'll do another micro practice. So this next one is just taking 3 breaths. So get into a comfortable seated position. And just draw your attention to the breath. Take a deep inhale through the nose. And sigh it out through the mouth. And relax the body. And softly blink open your eyes. And just ask yourself, what's important now? So this little practice here, asking yourself what's important now, is a good practice to do when you're transitioning between tasks. So similar to our moment to arrive, when you're about to begin something new and you need a second to yourself, asking yourself this "what is important now" question can be really powerful. So hopefully you enjoy that little micro practice, and we'll just move on.
So here's the pieces that are some of the take-home pieces that we'll have today, and we'll do a little bit of work with this as we move forward. So the first area that we really want to help people with in mindfulness as it relates to stress is concentration. How do you focus on one thing to the exclusion of a bunch of other things? And for many of us, when we have this repeated hits, this is the hardest thing to do. Our attention seems to be all over the place and nowhere at once. So we can do very focused practices. You know, Alyssa just gave us a good example of the breath, but something that we can kind of concentrate on that lets us move our mind in one direction for a sustained fashion without bouncing all over the place. And if the mind does bounce all over the place to whatever we need to do next, whether it's take care of a parent, go get something from the grocery store, you name it, we can bring it back to whatever it was that we were focused on. And this is a very deliberate practice and takes real training. The other piece that a lot of that we find really helpful, that's central to this concept of mindfulness, is the notion of open monitoring, which actually is the one thing that used to be called mindfulness. And really, that's that notion of being able to have to be able to think about your thinking, to have a meta awareness of yourself and your surroundings, so that you're not so kind of in the mix all the time, that you can kind of take a step back and look at the situation as a whole and look at your response as a whole. So if the mind wanders, you know where the mind wandered to and you can bring it back. When the chest gets tight, you can be aware of the chest getting tight and have some control over that. When the stomach is turning, that you can be aware of that. The other piece with open monitoring is you can really savor experiences that are meaningful to you. So when you're going on that walk, you see the flowers, you see the trees. When you're engaged with somebody, and this is an area of interest for Alyssa, that the communication's a lot clearer simply because you're more present. If you're like I am right now, and I have a new baby at home, you can kind of really engage around those dynamics around sort of being with the child, and sort of staying in the moment, focusing your attention and being aware of the experience as a whole. The other piece that we really work with people a lot around is this, again, here's another $10 word, this notion of interoceptive awareness or internal awareness, which is really the sixth sense. I'm going to tell a dated joke here. We're not talking about the Bruce Willis sixth sense. We're talking about the sixth sense in terms of being aware of our internal environment, so that we have very strong internal cues around if the heart is racing, if the stomach is tight, if we're tense, if we're relaxed. But again, using this skill of non-judgment so that we're not over somatizing and worrying, but we're just noticing these things about ourselves and having a good sense of the body as a unit and many of the processes. And what we find with people over time is they develop this up. It helps them stay at a 2, and they're not as likely to get up to sort of like a 4 or 5 or 6 before they notice that there's a problem in terms of tension and challenges like that. The last piece, and the one that we're finding in the emerging research is becoming just more and more important, are these relational dynamics. And I'm not going to say anything politically today, nor would anyone ask me to, so we won't do that. But a lot of what we're working on with people is just sort of fundamental, that ability to see the perspective of another person non-judgmentally, to be able to hear another view non-judgmentally. And then I think we had a talk last week or the week before, excuse me if I can't remember the timing, Christina Noel, around self-compassion. So that ability to relate to ourselves with this ease, empathy, and compassion. So these are kind of our 4 categories that get sort of included, and not to judge yourself. Olga, gold stars. And not to judge yourself. So this is very, very helpful. So we'll move on.
Yeah, and now we just want to flip it over to you with a little poll. So Mike just went through, there's 4 different categories of this contemplative practice. Which part do you feel in your life that you need to cultivate more of an interest in or practice more? You just want to take a moment to answer the poll question. And then perhaps we can share the poll results with everyone. Great, so I'm seeing everybody really wants to cultivate more of this concentration. So I know that can be difficult sometimes, especially as we were talking about earlier with all of the different demands and the screens that we're using. And then a close second with the mind-body awareness.
Yeah. So this is really interesting, actually. We did this in last fall with a group of about 140 health professional students that are in our various health professional graduate programs at the University of Delaware. And it's really interesting. The response rate was very similar. People are really focused on how do I just attend to one thing at a time, and how do I have a better sense of what's going on in my body. So certainly we'll try and talk about that a little bit today. And that's also something for, if there's some interest in us doing more over time, those are areas that we can focus in on a little bit more with a little bit more vigor. So here's the good news with sorry, I'm off with I've got one set of slides that says who's doing what. So this is Alyssa. Sorry, Alyssa.
You're good. We went through a little explanation of mindfulness, and now we'll tune into what are the benefits here? So what's the point in practicing? So mindfulness is one of these things that with practice and over time, maybe you won't see this, giant shift the next day, but over time it can really just shift our overall sentiments toward things, whereas just pleasant experiences become a little more pleasant, or maybe negative experiences just become tolerable. So it's just over time with these practices of whether it's concentration exercises, awareness, or tuning in with self-compassion practices, you may notice a shift in your emotions. Can you shift over?
So as we start to take these mindfulness practices, whether it's attention on something as simple as the breath, whether we're focusing on just being present within an experience, whether it's focusing on somatic keys in the body or really just being within relational self-compassion, things of that nature, we want to be fairly prescriptive when we're working with people. There's a lot of different practices, and sometimes people feel that part of it's really daunting. They get a great app like what's the big one right now, Headspace or something on their phone, or maybe they read a book and they're like, do I have to do all of this? And it says that I should be doing it for this long, and I don't know if I like this one and that one. And these prescriptive elements are things that we can kind of talk about at another time. But in terms of really simply just starting to develop a simple practice of mindfulness, and we're going to give you some resources in a minute. One of the first things that we want to start with is, where are some places where I would like to start to apply this? So we can really look at our own patterns of behavior, and simple ones to look at are, environmentally, what's going on physically for me in this situation? What's going on, in terms of breath, in terms of motion, in terms of cognition in this situation? And then the next piece, and again, this can be positive or negative. We don't want mindfulness to be sort of seen as this sort of clinical intervention at all times. It can be highly, highly wellness focused. This next component that we often work with people around is, once you've sort of brought some awareness to our lives and places that we're trying to cultivate some more of this mindfulness, what are these dimensions that we want to sort of bring up, and what are these dimensions where we need a little help? So again, it might have been clarity of focus, which many people have said. It might be more familiarity with somatic cues in terms of interoceptive awareness, which a number of people have indicated. It might be working with something as simple as fatigue, or the other end of that continuum, anxiety or ruminative thought. And from there, we can kind of start to develop this prescriptive plan when we're working with people. We can really start to use some of these tools to make these conscious decisions around how are we going to cultivate some aspects of our psyche, of our environment, of our work, and start to minimize and deal with some of these other components. So we'll go through a little bit of a plan here in a second in terms of how that might look.
So with that, what do you believe that mindfulness will look like for you in your daily life? So we went through a couple different practices, some examples, and then we discussed the 4 different categories, where it be concentration, mind-body practices were some things that you were interested in. So when we talked about earlier this, idea that we're moving through life and we get hit with these punches, maybe taking that time to recover. So maybe mindfulness is a way to recover. So take a moment to consider for yourself what this is going to look like for you. And so we can go through a little goal setting together. So this is a helpful little exercise. So asking yourself, right now, you all shared earlier what your kind of stress level was from a scale of 1 to 10. So thinking about that stress level, are you making the time right now for yourself to recover? And what kind of goal can you make for yourself around that? Just using mindfulness as sort of a tool, and creating your goal in this I will format can make it very affirmative and make you feel committed to it, like it's an actionable step. Identifying a strategy for what you're going to do to reach that goal. So for example, if your goal is simply to just make some more time to recover, then finding a strategy of how you're going to get there, such as using a guided app or some of the resources that we're going to share with you. And then setting a target for yourself. So considering how often or when, specifically picking out a time for yourself during the day or during the week to rest and recover, or dedicate to one of those practices, such as a practice for concentration or one of the other categories you may have picked. Oh, perfect. And we see one sharing, I will make more time to relax.
So a lot of what we start to work with people around is this notion of introducing people to some very, very simple practices. Again, we're not looking for anyone to do anything particularly esoteric or particularly time intensive, especially initially when we're working with clients and patients and all the populations that we work with. So we tend to work in a very prescriptive way, as well as in a very sort of step-by-step phase. We're not expecting anybody to run a marathon the first day, certainly if you've never run a marathon before. That all being said, knowledge around mindfulness is absolutely wonderful and important. It certainly gets us on the road, but cultivating a tangible skill set is kind of is what we're trying to work with people around the most. So we're going to give you some resources here in a minute in terms of just a number of different practices that people can start to engage with. We know that the best way to sort of reap the benefits of mindfulness is to practice it in a consistent fashion. And that can certainly be formally using something like an app or engaging in a class. We'll give you some resources that way. But it can also be informally when we're just sort of out and about. As I had mentioned right now, a lot of my practice right now is just engaging around a very, very small child. So the challenge with this is once we becomes a practice point versus more knowledge, that's where we see the challenges in terms of sustaining it. So we say really simple things, try and do it maybe first thing in the morning so it just gets done and you don't have to worry about it throughout the day. Pair it with another activity. So if you're walking at lunch or if you're needing to take breaks, you can do a little practice then. Full disclosure, some of my best practice I ever had is I was working in an addictions facility as a counselor. And I'd have some pretty heady cases and I couldn't necessarily get out all the time because it was a locked unit. So I'd go sit in the bathroom for 10 minutes. So I think everybody wondered why I was in the bathroom, but I was doing a lot of mindfulness practice. Know that the first few weeks are often really challenging, but we want to work with people to make this habitual. But we don't want to work with people so it feels like just another thing. That really it's this piece that starts to permeate all our other activities versus just this other thing that we have to add on a list that's already too long. So we'll just move ahead, Noel. Alyssa, do you want to take this one?
Yeah. So here are some examples of audio and video recordings, and I believe we sent Christine a resource sheet as well. So these links will all go out to you. We have our own Mind Body Behavior Lab here at UD, which Mike McKenzie here on the call is director of. So we have our own recordings up there that come from Google's curriculum Search Inside Yourself, as well as other guided meditations. So these are really nice to just take a little sample of going through a guided practice. So using these guided practice is a really good way to get started. Many times we have this idea in our head of what it means to be mindful and meditative, and having those that guidance can be helpful. There's also resources here. Just trying to move the little video for USC from University of California, San Diego, as well as UCLA. So they have their own mindfulness programs, as well as recordings and some extra stuff that you can sign up for a course as well. So we can advance. We have some other resources to share with you. These are some different mindfulness apps. You may have heard of them. If anybody has one in particular that they use, you can go ahead and share in the chat box. I particularly like Insight Timer, but all of these, Headspace is very popular these days. Most of them are free, or at least have a trial. Sometimes they have different avenues you can explore, such as ones for sleep. And then we can advance to the next resources. Yeah, so where we'll leave you here now. So where you set a goal, and many of you shared goals and in the chat box here. So maybe if you didn't set a goal quite yet for yourself, just taking the time over the next week or so to practice one of these resources that we shared. Again, you can check out those guided practices that we'll send out in a resource sheet. And if Mike has anything else to add about sustaining practice or moving forward.
Yeah. The other thing that I think is really important to highlight is we have a lot of really wonderful resources right here in Delaware. So there's people like Carolee Palmer, Bill McCracken, Amy Griffin, Barbara Lay, Laura Sawyer Reardon, Sarah Burka, Sam Beard. So there's just tons of people that are doing really interesting work within the state as well. Many of whom work closely with the mobile health group and work with Rita Noel's larger group. So there are lots of local resources, and certainly we're here as well. But it's a pretty big ship with and lots of opportunities to work with people across the state. So I think that's really valuable. The other thing I'm seeing here is some questions around cultural appropriateness of different mindfulness practices and different resources. It's such an important question, especially every time, but it's become of primary importance given everything that's transpired here in the last few months. There's a number of different resources. I saw that Noel had shared some, and we're certainly available to share more resources if that's an area that people are interested in. It's certainly an area that we're interested in. So whether that's language appropriate, culture appropriate, we have a lot of resources that way. So sorry, in terms of the homework piece, so we say start small. What's something that you can do for 3 minutes a day just to get started? We've given you a lot of resources. We've done a few sort of shorter practices today. Guided practices are great forever. Some people like when they first get started. Some people use them all the time. So certainly Alyssa had given you some resources in terms of different institutions that offer things, and those are all free, by the way. Nothing. Some of the apps I think have a cost for their like full meal deal ones, but everything in terms of the university links we provided and the apps usually have a freebie attached, so you can just try things out and see if they fit. So here's some other quick links here to those programs that you can use. And then the other piece we often say is, where are the places where you can integrate this to your life? Is it in the driveway before you go from, I guess that's not such a good one anymore because nobody gets to go to work anymore. But it used to be, before even going in the house, do you do a little practice? When you get in the morning, do you do a little practice? Is there an event where you need some practice? So what are these little pieces that we can just kind of add in, that we can weave into our life versus feeling like we need to sort of add another piece to a plate that for many of us is already sort of overflowing? So we're certainly able to take questions right now, and I know Christine's gonna moderate those for us. So she'll read them, and we'll do our best.
Great. Thanks, Mike and Dr. McKenzie and Alyssa, so much for this wonderful presentation. And we do have some questions. So the first question we have, is it more effective to reflect in the morning before starting the day or in the evening before bed to clear your mind?
I think both and is the answer here versus either or. So for some people, when they're first starting out, we say, let's just have you do it something early in the morning so you can just sort of get the day started with a little practice. And then the other piece is to do it at the end of the day. So I have people that are early morning mindfulness practitioners. I have people that are the end. I have people that do a little bit of both. The best advice I was ever given many years ago from a colleague was, Mike, do not end the day without, he called it assuming the position. So without having engaged in some small formal mindfulness practice. So even if I miss it in the beginning of the day, by the end of the day, I've engaged in something, even if it's just for a minute or two before my head hits the pillow.
Great, thank you. Next question is there an app you would recommend for kids, teens, and tweens as well?
Alyssa, do you want to, or I've got a couple. What do you think?
Well, you can share, and then I'll piggyback on that.
I love this one called Settle Your Glitter. It is like the best app. We use it with kids all the time. I was part of a program for a number of years where we were working with moms that were in medically assisted treatment for opioid dependence. And the moms loved it, not only for the kids, but for themselves. And really, it's just this app. It's a very strong visual where it's like literally glitter on your phone, and you watch it and regulates, and it really sort of helps you calm down. And there's another one where it's bubbles, and that focuses in for kids, because they don't need a lot of narration. That can be really helpful. But like I said, I know plenty of people that thought they would do it with their children, but they use it for themselves regularly.
Great, thank you. Next question is, what do you suggest regarding keeping yourself motivated when you are working from home and not interacting with people on a regular basis?
Alyssa, do you want to take this one? And I'll jump into.
Yeah, so as far as now, I think just kind of remembering to take those little moments throughout the day. I think, when we're in the office and we're out in the community, we have time to sort of like walk around between meetings or take a break. So now as far as like putting this into our life, it's even more important, I think, whether you're just taking a minute to literally close the laptop, take a deep breath, walk around, squeezing it into your day. So I know that sometimes finding time can be tricky, but I think when you find that you take those 1 minute, even 2 minutes, you'll find that the benefits of taking that little refresh, go even further than, feeling like you dedicated, that you're wasting time from your work.
Yeah, I mean, and that's a huge area of practice, is just that belief that this is me taking undue time away from my work. So structure is important. Doing something in the morning is important. But I think the big piece to kind of point out that Alyssa didn't have a chance to cover yet is just this notion of maintaining social connection is so important. And even if we're on Zoom all the time, we're not really connecting with people the way that we normally would. So make time to maintain those social connection. Many of us are sort of very far away from friends and family right now and not able to see them the way that we would like to. So how do we use the tools that we have to reach out and connect? And sometimes that needs to be very, very structured until you sort of start to do it again, because it can be a very lonely time right now. And we know with all this COVID stuff that one of the big things that people are dealing with, let alone the stress, is the loneliness, which is, of course, is a stressor in itself.
Great. Do you have a list of community resources in Delaware that you would be willing to share?
I think we can probably put something together. Noel, I'm looking at you. Maybe we could put something together. And then a good clearinghouse right now where they're doing a lot of interesting work is Sam Beard's gift group are really doing a lot to try and get teachers together. So I think there's some value in checking him out. So just type in Sam Beard gift. Sam's got a great website. But certainly we could Noelle says she's nodding yes. So between all of us, we will get a resource list to people.
Okay, another question came in is, I have asthma and focusing on breathing has been associated with panic attacks. How do I overcome this?
Don't focus on your breath. No, and sorry, that came across as flippant. First, I want to really normalize your experience. This is really, really common with respiratory issues, with a number of different issues. So we find another cue that tends to be more something that basically we want to focus on relaxation response first, especially if it has been panic inducing. So what's something that we can do that can relax the body first? So there's a lot of research in the area of something called the relaxation response, and a researcher by the name of Herbert Benson. Basically, we just want to find something quiet and repetitive to do in a focused fashion. So sometimes people will focus on repeating a word to themselves. Sometimes people will focus on the pitter patter of their footsteps. People will find sort of something habitual to do. Sometimes people will focus on sensation of warmth somewhere in their body, and kind of start to focus their attention that way. But certainly, if breath is anxiety generating, and absolutely, as related to a medical condition, we want to find ways to work around it. We certainly don't expect anyone to sort of move into that head on. That can be really, really counterproductive, and that's not helpful.
Great. I think that may be all of our questions, unless anybody, we can take a moment here just to see if anyone had any last minute questions they'd like to ask Dr. McKenzie and Alyssa that they could answer for you. I do have another one that just came in. The question is about prolonged stress has an impact on the body. How is that reversed? Excuse me. If prolonged stress has an impact on the body, how is that reversible?
Right. That's such a great question. So my pause here is how to do this in a way. We never want to put into a situation where we don't want to be in a panacea situation where we can fix everything. We don't want to be in a situation where things are irreversible. A lot of the model that we use, and we use this with brain health, is that same sort of fitness model. We can have prolonged stress in an area and atrophy as a function of that. And we can, through sort of mental training and some of these other shifts in health behaviors, that's how we start to slowly, generally reverse things. And it's interesting when you look at some of the new data out there, when we're doing imaging around mindfulness, we certainly see cognitive function looking similar to somebody that's a younger age, if people are engaging in sustained practice. So there's certainly some physiology, some neurology that goes along with this belief that we can, as you say, reverse some of these challenges that we face as a function of very normal stress. So the word that we use within a research perspective, we call it allostatic load. So how do we reduce allostatic load so that people can sort of regain that fitness in their system?
Good, thanks. I do have another question here. Are there research opportunities for people to participate in mindfulness research as study participants?
Yeah, so COVID, what a thing. Normally that would be like a resounding yes. Right now, Our lab as a whole has kind of put all our eggs in our cancer coaching study right now. But certainly we've done a lot of work at the university, particularly with our student population. Alyssa, you can speak to some of the work that you've done in the past 2 years. So we're always looking for opportunities to re-engage, particularly on campus students. And then we work a lot with community-based agencies. So sometimes we work with a community partner around developing sort of interventions and programs in this area of mindfulness. So those are kind of 2 areas. But right now, everything's kind of been refocused just as a function of everybody trying to survive in these times that we're in.
Great, thank you. So this one just came in that this individual is interested in Black maternal and child health disparities. Can mindfulness help with weathering that impact on infant mortality rates?
It's a really interesting area. There's a group that's looking at that at Temple right now, and then our group at the group that I'm not as involved with anymore at Thomas Jefferson University certainly has an interest in around maternal and child health. So there is some research that's out there. This is something where potentially we've got some research in the area, so maybe I can through Noelle or Christina, I can send you out a couple of papers, and certainly you guys, everyone has my contact information on this slide. So if you want to reach out via an email, I'm certainly happy to send information your way.
Great, thank you. Thank you, Dr. McKenzie and Alyssa, for this wonderful presentation, as well as taking the time to answer the questions that our participants had today. And thank you to all of you who joined us today for this webinar. Thank you very much. Again, this is our 3rd webinar in our summer 2020 series. We are hoping that you will be able to join us next week, same time, 2 p.m. We will be sending out either later today or early tomorrow morning, eval for this webinar out for next week's webinar, which is again at 2 p.m. And I believe the topic is nutrition and diabetes. So again, next week at 2 p.m. And thank you, Noelle, for all of your assistance in the background for this webinar and our whole entire webinar series. And again, to Dr. McKenzie and Alyssa for taking the time to be with us today and to present a wonderful topic to our community. We really appreciate your time.
Thank you, and I'm sorry for some of the technical difficulties. Just use that as a nice reminder to take a breath while Zoom is glitching or there's a delay. The universe is telling us that's time for your mindfulness break. So thank you all for your patience and for participating. We'll see you next week, hopefully.
Yes, everyone. Thank you. Thank you.
Thank you, everyone.